Hi and welcome back to Wellness Explained. I am Nyanzi and today we are going to speak about this sensitive topic that many women ask about. What really happens to your vagina and reproductive health if you stop having intercourse? Let's talk about it professionally and openly. First, it's important to know that your vagina does not depend on intercourse to stay healthy. It's self-cleaning and it's maintained by hormones like estrogen. Stopping intercourse will not make it to close up or dirty, but you might notice a few changes. These changes depend with your age and hormones. So, let's look at hormonal impact and vaginal health. Sexual activity increases blood flow to the pelvic area and helps maintain vaginal elasticity and lubrication, especially in pre and postmenopausal women. Here are a few things you might notice without regular stimulation or arousal.
Your body may produce less natural lubrication. Some women can experience tightness or even discomfort during sex, especially after long breaks. And after menopause, the drop in estrogen can lead to vaginal atrophy. This means thinning of the vaginal walls, dryness, or irritation. One common side effect of long term abstinence is pain or discomfort during sex without proper lubrication.
Now, let's look at this very common question. Does stopping intercourse affect fertility? The answer is no, and here's why. Ovulation and fertility are driven by hormones, not sexual activities. However, age and hormonal imbalances naturally reduce fertility over time. Now, let's look at what happens to the pelvic floor and the muscle tone.
Sex isn't the only way to keep your vaginal muscle toned, but it does help. Long term abstinence may lead to a slight weakening of the pelvic floor muscle over time. The good news, you can maintain and even improve muscle strength with simple exercises like Kegel. They support bladder control and enhance sexual health.
Now, let's discuss and see what happens to your menstrual cycle. Your menstrual cycle and your vaginal discharge will not stop or become abnormal just because you are not having any intercourse. However, if you are under stress or you're changing your lifestyle habits, you might as well notice temporary changes. But these are not directly caused by abstinence. Now, let's see what happened to your psychological and emotional health. Sex produces estrogen and endorphins, which are the feel-good hormones that supports your mood and bonding. Long-term abstinence may cause the following. 1. A dip in libido, especially if due to stress or trauma. 2. Feeling of loneliness or reduced intimacy in relationships. But this is not always the case because some women feel more focused, clear, or emotionally balanced when not sexually active. In short, abstaining from intercourse does not damage your reproductive health or your vagina. But there may be changes in lubrication, elasticity, and emotional well-being depending on your health, age, and lifestyle. If you experience discomfort, pain, or hormonal symptoms, talk to your gynecologist. Thank you for watching Wellness Explained. If you find this helpful, please like, share, and subscribe to this channel and leave a comment on what other health reproductive topics you would like me to cover next.